everybody. I want to introduce you to Dr. Richard Natale, joining us today from Carolina Urology Partners. We're going to be learning about penile implants because Dr. Natale is a urologist and men's health specialist in the Charlotte, North Carolina region with Carolina Urology Partners. So welcome, Dr. Natale. Tell us first and foremost, before I start asking you about penile implants, who you are and how you got into men's health in the first place.
As we've kind of talked about on the side before, you're from California originally, born and raised. My educational travels took me out to the East Coast, where I did my training at University of Florida in urology. And I chose the field of urology because I loved the kind of combination between some minimally invasive and surgical procedures, some, what we used to joke is maximally invasive surgical procedures, but also that plus a way to have relationships with patients and manage chronic issues as well. So I naturally gravitated towards that. And then in the field itself, really started to gravitate towards men's health, primarily because I enjoyed that relationship, having that chronic relationship with folks, but also being what I think is a men's health advocate and kind of seeing a certain group of folks that were underserved. It really drew me into that, so I could be a champion for those patients. So I really started to enjoy all aspects of what they call men's health, related to prostate issues, erectile dysfunction, testosterone. So really was interested in doing all that, and have then spent the last decade of my career honing in my skills and focusing on those types of patients.
Thank you for that introduction about yourself. And now tell us about what a penile implant is and what some of the benefits are.
Penile implants, first of all, I think that the neatest thing to know is they've been around in the particular current form they are for about 50 years. About 50 years ago, a urologist, kind of in those garage labs, so to speak, these stories you hear, came up with what's called the three-piece penile prosthesis, the modern implant that we use now. It's two cylindrical rods that are placed in the penis that are deflated, a pump that can go into the scrotal sac right underneath the skin, and then a reservoir of fluid that's located in the abdominal cavity. That device has been, of course, perfected over the next 50 years, but is a very elegant way of using a hydraulic system to get a patient back to their functional state that they need to in what can be probably, believe it or not, the most natural way, certainly spontaneous and all of that stuff. The device itself works to get the penis as rigid as necessary and for as long as necessary to accomplish a job. And that's the basic runnings of it all.
Now that we've covered the benefits, if you could just tell us about some of the risks with having a penile implant.
Yeah, of course, with any type of operation, there's always going to be some degree of risk that we have to take in consideration. When we look at penile implants in particular, the things that we worry about or control for the most is going to be the issue of implant infections. So we try to do our very best to limit that, and that includes using particular implants that have antibiotic medications actually embedded in it. Certain techniques that we do during the surgery, before and even after, in terms of antibiotics and all the rest. So infection does occur. Now, the rate of infection is a little bit higher in men who have, for example, poorly or marginally controlled diabetes. There are some studies that suggest increased risk in men who've had spinal cord injuries who have implants. So we do take into even more special consideration those folks. But infection is the one thing we worry about the most. In terms of other issues, really it's the satisfaction a patient has the implant. While overwhelmingly satisfied when we survey patients and their spouses, there's still some men who will either be dissatisfied because they feel it's perhaps unnatural, or they might have discomfort with operation. And so there is that dissatisfaction rate, which some contemporary studies would put it less than 5%. So those are the things we worry about the most. And then there's more unique circumstances to the particular patient that we would consider if we were to discuss the risks of surgery.
And Dr. Natali, what would you tell men about navigating the implant decision-making process? What might that conversation with their partner look like?
This is a conversation I have so frequently, obviously, with my patients, being in that I'm what I focus in on, particularly in prosthetic urology or with these implants. I think the key here is to start off first with understanding what the benefits of, or pardon me, what you're trying to look for in terms of outcomes. Some patients look and say, I need to go through a series of failures before I'd ever consider a surgical implant. Okay, that's a reasonable take on it. But what I say is, instead of doing that, what about looking at what sexuality means to you? For some men, sexuality is something where, they may have intercourse with their spouse 3-4 times in a month, once, maybe twice in a week, or if they are sexually active more than one time that in a session. Well, that person may have a different outlook in terms of what they need out of their treatment option versus someone who may have intercourse 2 or 3 times a year. So I always tell patients to start off with understanding what sexuality means to you, what you're willing to put forward with this. What have you tried, and what has worked and what has failed? So when you start off that discussion for thinking about an implant, really look back at what you've gone through. And certainly I have men who come in saying, I tried Viagra once, I want an implant. Well, maybe you need to go through the discussion and the rigors a little bit more. I certainly have the more common scenario, which is guys who feel like they got to get all the way to the end of the race before they can finally say, here's an implant. And there's no reason to take it all the way there. Again, it's a personal choice. It's one that we make together. I always encourage open communication with myself and with their spouse, so we can all be on the same page. That's key.
Yeah, I totally understand that. And what would you say to someone that was intimidated by the idea of having an implant?
You ask that question. This is a true thing. Whenever I have patients in my office who say to me, I'm worried or I'm intimidated, my first statement back to them is, good. That means you have a healthy understanding of your own feelings, right? I almost feel more worried by a patient who just gung-ho, doesn't have any questions, I'm ready to go, because it's expectations. This is a surgery. It's a serious surgery. It may be one that is not super, super complicated. It's something that is performed on a frequent basis and all the rest, but nevertheless, it's in a very ginger area, obviously, and most importantly, it's something we just shouldn't take lightly. So I'm actually encouraged by men that have a little bit of trepidation. That's a good thing. With that being said, I also try to sit down with them and using what I just said about laying out goals and expectations for the future is, hey man, listen, we're trying to work together to get something back to where you were before. Let's look at the long-term benefits so we can get past the short-term kind of fears that you have. So again, it's a good thing to be, to have a healthy understanding of it, be nervous, but realize that we do this all the time and we can get guys through it pretty well.
Everybody, you've been listening to Richard Natali, a urologist and men's health specialist in the Charlotte, North Carolina region with Carolina Urology Partners. We've been discussing penile implants and introduction to penile implants. Before I move on to wrapping this interview up, Dr. Natali, I want to know about the insurance situation and what you could tell us about that. Does insurance typically cover the implant?
So from a government kind of insurance perspective, Medicare will cover it. The state insurance of Medicaid typically does not, or it may vary state by state. Medicare will. And obviously, most of the men who are getting implants are of Medicare age, but not all of them. So the men who are of younger age, for whatever the reason they need it, if they have commercial insurance, we will work with them to run benefits and check. The company that we work with in terms of the penile implant, they have services to help us understand what your particular insurance benefits would be. And yes, occasionally there are companies that have an exclusion of their policy that will not cover it all. But by and large, a significant number of insurance companies in the private arena will actually cover the surgery.
That is great information to wrap up on. Again, Dr. Natale, any other final thoughts? Anything else you think might be of value to listeners before we end it here today?
I think the biggest thing I'd tell folks is what we just kind of ended on earlier, which is, have a healthy perspective. It's okay to be nervous, open communication, and really understanding what this means to you and sharing that with me. I tell this joke, and this might be a good way to end the discussion. Kind of joke with my patients, say, I don't need to know if you wear a clown suit when you want to do what you're doing, but I need to know if you can't. And if you can't do it and you need help, that's what my job is. I'm here. We talk, we have an open communication, we'll solve the problem together.